Hi, I'm Dr. Kelly Starrett with the Ready State. One of the oldest maxims in rehabilitation or pain management or restoration of movement and the movement system is if something's not moving that's supposed to move, let's get it moving. That makes a lot of sense in the context of using H-wave as part of a rehabilitation or pain process. Because ultimately the H-wave is about facilitating movement, either getting you out of pain so you can move or decongesting a tissue so it becomes a lot more comfortable to move. And remember, that movement that's happening in that low frequency contraction is movement without motion. So one of the things that we're always trying to do and be about at this company is reminding people that, hey, part of the game here is to make sure that we, especially after surgery or trauma or even chronic pain, that we bring that body part back into the fold, that we sort of reintegrate those damaged or injured tissues or tissues that we're afraid of, and we begin to sort of normalize touch, normalize movement there. Now, one of the ways that we can do that, obviously, is by using this low frequency setting, by getting that just good muscle contraction that feels safe. We're getting a lot of signaling that it's safe to move. But we can actually go a step further. So in between sessions, one of the things that we tend to see is that after surgery or trauma, or even kind of chronic pain, is that people aren't real comfortable touching an area of sight, especially after surgery. And correctly, we don't want you to get an infection. And so what we often say is, hey, let's not monkey with that actual insertion or that incision until it's completely healed. But what we can do is say, hey, I need to get movement in and around that system. I need to restore motion in many ways, and I need to signal that it's actually safe. For example, after knee surgery, very few people actually touch their knees, and they certainly don't touch their scars, even after they're well healed. So what I'm going to suggest is a simple idea that you're going to grab a towel, and I like the towel because it gives us a little bit of tactile feeling. Again, the area is clean. We're not going to monkey with that. If it's bandaged, keep the bandage on. But I can still go over the top here and work on getting those tissues to slide and glide in many motions. So if you touch the skin over the back of your hand, notice that that skin slides in all directions. But if I tighten that up and all of a sudden the skin didn't move, what I'm going to see there is I'm going to get reduced hydration, reduced nutrient delivery. The tissues are going to be under more tension. It's going to be harder for me to decongest the normal sort of byproducts of my body there. So what we have is a real tack down kind of stiff system. And that is a system that is not going to load well or respond to loading very well. So an easy way to do that is for me, because it's my own body, just to take a towel and simply start to work on sliding and gliding. Work on just kind of grabbing the tissues. I'm not sliding over the surfaces. Instead, I'm just grabbing the surface and working on sliding back and forth. I can do that side to side. I can pucker. I can get motion, especially if I've got a painful site. But this touch signals to my brain that it's safe. But it's also a really important and meaningful way for me to start to make sure that I'm not losing mobility and motility in that area. And especially after we've had a repair where the body is starting to kind of repair those systems, and it's like running staples through these beautiful sliding layers of silk. And what I need to do is make sure that those staples are sort of not tacking all those layers together. So just by grabbing a simple towel, and again, respecting your surgical site, none of this should feel painful, nothing should be tearing, it shouldn't be causing opening, but adding some motion in, even above and below your surgical site with just a little bit of movement. Again, keep it clean, no big deal. And this early mobilization mechanically of these tissues are really important. And what's great is that it might start to feel really good, and then if it starts to feel terrible, you're done. But regular movement of a repaired tissue, of a mobilized tissue, can go a long way to support the additional contraction that we're getting with the H-wave. So the H-wave is going to take care of getting the muscles to move, but we want to just make sure that on the surface and through some of these other layers, even through, let's say I had a little repair just above and below, getting those tissues to ring and move can be very, very powerful to enhance your healing. Make sure that you just have a towel around and don't be afraid to own your own body. Even if you've had a repair, let's keep it clean, but let's get those tissues early mobilized so that later on we don't have to have a killer set of power tools to get them moving again.